Thank you for being here. This is about what I consider to be a missing link in injury recovery. Okay, we call it inhibition. I'm going to explain about why, but for the sake of right now, just understand the word inhibition is the key word for today. All right? We're going to bring up trauma, we're going to bring up stretches, we're going to bring up pulled hamstring. Inhibition is the key word out of this entire presentation that I want you to understand differently. Okay? So, a little bit about me real quick to tell you what the heck I'm doing here and that I do have a little bit of validity in what you're going to hear today. I have 2 bachelor's degrees, one in anatomy and one in health and wellness. And then I have a master's degree in functional nutrition and then my doctorate in chiropractic. There are all sorts of certifications that I've been interested in getting, but in the end, I have found that the body inhibition training that I've received has been more educational than any other certification I've looked into. So technically, I'm also certified in what they call neural pathway integration, which you're going to learn about today, and advanced muscle integration as well. All right, and those 2 are the techniques and certifications that, in my opinion, have been the most educational that I hope to teach you about today, all revolving around this idea of inhibition, okay? The goal is just to answer this question: why don't all bodies heal fully after an injury? You roll your ankle. People will go, well, a break is better than a sprain. Because if you sprain your ankle, then you're going to have bigger problems long term. I want to explain why that is and how we can correct it. The same idea applies to a bad knee, a bad arm, a bad whatever the joint is. Why doesn't it heal fully? The doctor, you went and got an x-ray, you got an MRI, you've been told it's all fine. Why does it still hurt? This theory revolves around inhibition. Again, I'm going to say that word a million times, but that's the one word I want you to understand that is different in this entire theory, okay? So, traditional injury recovery includes a couple of things, right? We know chiropractic, I'm a chiropractor first, okay? That's where most of my education is all about joint manipulation, adjustments is what they call them, okay? But that's what they do, is they correct the bone. Then we have, well, chiropractors are great, but what about acupuncture? Acupuncture is all about correcting energy flow, okay, which is fantastic. I'm not beefing on any of these practitioners right here, right now. I'm saying that currently, if you were to Google, "I am in pain," this is what comes up. These are your options, okay? And you have that chiropractic, acupuncture, massage. Their goal is to relax tight musculature, which does provide some significant relief. We're going to talk about it a little bit more in the future, but it does provide significant relief, but might not always be long term. If you ever feel like you get a massage and then 3 days later you're like, I think I need another massage again. And that's my experience with chiropractic as well. You go to the chiropractor and you go, 3 days later, I think I need to go back because that joint they shifted might be out again. Okay, so that's kind of this idea, is that the problem with all of these is that the pain returns once the treatment stops. All right, you go to your chiropractor 3 times a week for 4 months. A month after you get done, pain comes back. Okay, I want to talk about why. Physical therapy is that same idea. They want to strengthen the muscle, which increases joint stability. That is the closest thing to what I do, in my opinion. Okay, there are some things, some people, some physicians now, chiropractors, that call themselves a rehab chiropractor that have very much gotten into the space of physical therapy. And I'm going to explain why. Then you have this medical pharmaceutical. You know that if it's not cured by anything else, they're going to throw a medication at it. They're going to try that muscle relaxant, that steroid injection, or they're just going to jump right to surgery and hope that scope in the knee or whatever it is that you do is the solution, that they can find it if they haven't found it on any of the imaging modalities they have. All right? So what is body inhibition? How am I doing on time? I'm going to make sure that I try and explain as much as I can in the short amount of time that I have. So inhibition is simply a body part that stops working correctly after stress, injury, or illness. Okay? Example, I mentioned the bad ankle or the rolled ankle. You roll your ankle. Well, it's weaker than it used to be. Well, why is it weak? We call it inhibition. Okay? Muscle inhibition for the sake of the ankle. You roll your ankle, you injure muscles, muscles become inhibited. We're going to talk about it in detail later. But that's the idea of inhibition, is that it shuts down and stops working correctly because of stress, injury, or illness. There's also a couple of other things we're going to explain. Concussion, injury, poor recovery after a surgery. That surgery is classified as an injury in my book. All right, they cut through tissue. They cut through muscle. The ligaments, they cut through it all. That's damage. All right, it's injury. Yes, there's a greater injury because they say, well, we're going to fix your meniscus, and on the way in, we're going to cut through these muscles, and they're going to re-heal. That is accurate. The muscle heals a lot better than the meniscus will. That's why they think the greater injury is, let's fix that. But then you get into the soft tissue stuff. It still creates problem to cut through a muscle. Okay? But these inhibited areas can stay hidden for years before causing pain. So you roll your ankle once, for example. Someone will say, you know, that wasn't a bad ankle sprain. That's because maybe in the one roll that you had when you were 16 years old, you shut down 3 muscles. You have 22 in your ankle. So of those 3, the 19 that are still working, they can do the job of the 3 that aren't. That's pretty good compensation, adaptation, if you will. You roll it again when you're 22, and you shut down another 5 muscles. All right? You're now looking at about 50% capacity maybe of the ankle, and that ankle sprain you went, you know, it took me a little bit longer to come back from that second sprain, but it's okay. After a couple weeks, it got back through it. It doesn't hurt anymore. Most people are concerned about the pain, and so the pain goes away, and they're like, okay, my ankle healed. By the time you've rolled your ankle 4 times and you're 45 years old, you're going, I just got weak ankles. If I step off the curb at Walmart, I'm done. I'm on the ground because I don't have that stability that I used to. A lot of dads, for example, will say, you know, I rolled my ankle so many times when I was playing ball in high school. And then they want to play ball, church ball. They want to play whatever basketball or game that they are participating in. And they're 45 years old and they say, I have to wear an ankle brace every time. Just because I got bad ankles. You know, they're weak. They don't do what they're supposed to do. And the idea is then that this inhibition has caused so many problems in the past that they need artificial stability, ankle brace, ankle tape, whatever it is, to create the stability that their muscles don't give them anymore. Does that make sense? Tell me if I'm going too fast as well, okay? These are different ideas that are a little bit more strange to swallow, because my biggest problem with all this was originally, so if inhibition is such an important thing and a big deal, why don't they teach it in school? Why don't more physicians know about it? The simple answer is that it's very much Eastern medicine based. And in America, we don't like anything that cannot be proved by or proven by research. All right? So I hope to explain a little bit more of that as well as we get going. But in research, the little bit of research that we do have, okay, it's done by physical therapists. They call it arthrogenic muscle inhibition. There are a couple of links here. This first one they call, well, it's the best evidence, mechanisms, and theory for treating the unseen in rehabilitation. They call it inhibition as well. They just call it arthrogenic muscle inhibition. The same idea applies, though. They're going to say, well, in this theory of inhibitions, muscles shut down, and it prevents the ability for the muscle to recover. All right? If your quad shuts down, you go to physical therapy, you start doing squats to strengthen the quad. But it doesn't strengthen. They call it arthrogenic muscle inhibition. Why doesn't it strengthen? Because of the inhibition theory. The inhibition theory, if I'm not mistaken, mechanisms, here's another that I listed 2. These are both from 2021 or 22. There are more that are older. I just like to keep the research a little bit more recent. But the reason inhibition is a problem, the muscle loses power. That limits the ability for the joint to have stability. Because muscles create stability in a joint. Would you agree? As the chiropractor, if I shift the bone, because that's my goal, if I shift the bone, but then 2 days later you feel the need that, oh, my back is out again, or my neck is cricked again, whatever that is, what's the bigger problem? My argument, the muscle isn't doing its job to hold the bone. So if I shift the bone, you come back 2 days later, I shift the bone, you come back 3 days later, I shift the bone, what's the definition of insanity? And expecting a different result. That's exactly right. So as much as I love chiropractic, and I don't like to talk negatively necessarily about my own profession, but that's why people have, it's become a lot more popular in the chiropractic realm. that they start to do rehab chiropractic because they found the same problem. All right? They said, well, inhibition is a problem. And if inhibition is not allowing the bone to stay put, then we need to create additional strength in the joint to keep the bone put. Does that make sense? So then the problem is with the theory of inhibition is that it's not just weak. They call it inhibition because it's not gaining strength. I like to think of it like a circuit breaker in a house. Okay? You've tripped the breaker. Everyone's got that blow dryer, right? That trips the breaker. Okay? You trip the breaker in the house. What's broken? Nothing. You just tripped a safety mechanism so nothing greater is damaged or injured or nothing greater happens. The muscle does the exact same thing. All right? If you're interested in the nitty-gritty, I can get down to it, but most people here are likely like, what the heck? It's something called the Golgi tendon organ and the enthesis organ. If you know what those are and you want to have a conversation afterwards, I would love to get in the nitty-gritty. Did you have a question?
So with ligaments and tendons, they get extra stretched out sometimes too, right?
Sure.
What happens with those?
So the ligaments are a little bit of a different story because neurologically they have a different connection. The tendon is where the tendon and the muscle belly connects, where the Golgi tendon organ sits. All right? So that's where, neurologically speaking, that is where the shutdown happens. You also, I mentioned enthesis organ. Is anyone here familiar with what the enthesis organ is, or the enthesis of a muscle? Okay, so I mentioned where the tendon and the muscle belly comes together. That's where the Golgi tendon organ is, okay? There's another thing on the other side of the tendon, where the tendon attaches to bone. That's called the enthesis. It's where the attachment site of the muscle to the bone is, or I should say the tendon, really. But that's where the enthesis is. They've now found something inside that attachment site. It's a little neurologic trigger, if you will, that they call the enthesis organ. That is what shuts down the muscle to prevent greater damage. Because, sorry, I'm getting a little bit in the weeds here, but if you roll your ankle and your muscle stays nice and firm throughout the entire roll, you roll it really good. If it's too good, you could tear the muscle, because if the tension stays in the muscle, it's going to snap. At some point, the muscle's got to give way. And you've likely heard people who have torn a muscle or avulsed a tendon. That's what happens when the twist or the strain across the muscle is too great for the strength of the muscle itself, or the attachment site strength. Does that make sense? The enthesis that I mentioned. Okay, and when that happens, you just need surgery. Okay, and we're going to talk about that a little bit as well, the difference between inhibition and tissue damage. But that's the kind of the idea of inhibition. Let me make sure that I haven't missed any of my other topics here. I'm going to go back to this slide. We covered all that. Yeah, okay. Yeah, so inhibition is different than tissue damage. Okay, if the tissue is damaged, you're going to need to fix the tissue. That's why stem cells, very popular nowadays. All these other is injections. I'm not talking about steroids, different conversation. But we talk about these peptides and all these different things that are supposed to stimulate healing. When the tissue is healed, then I consider it inhibition, because that safety mechanism is still tripped. But if I try and reset this safety mechanism, the inhibition, and the tissue is still damaged, it's just going to trip that breaker over and over again. So you need the healing to be done before we can get to the inhibition. Does that kind of make sense? All right, I talked about those. Okay, so muscles lose power, the joint loses stability. So we're talking about ankle pains, we're talking about knee pains, we're talking about hip, we're talking about anything that a muscle crosses. If the muscles shut down, the joint loses its stability. Okay? Now, is it possible that other things can become inhibited? In this theory, the answer is yes. Okay? So if muscles can become inhibited, can a nerve also sustain damage, trauma, whatever it is that causes that? I mentioned over here the most common ones are stress, injury, illness. Okay? We can tack onto that recreational drugs, we can tack onto that all sorts of medications, we can tack onto that all sorts of things that we don't know really, in my opinion, what the full effect on the body is, okay? But as a whole, we'll call it stress, injury, or illness, okay? Now, these nerves, if they don't send clear signals because they're inhibited, you then get miscommunication throughout the body. Have you ever heard of what do they call it? CRPS, chronic regional pain syndrome. Yeah, that's the idea that they don't know what's wrong. You've passed all the x-rays. There's no MRI. There's nothing, no test that they have found that will tell you that you have problems. And so what they call it, well, if you still have pain, you have a complex regional pain syndrome. And that's what they call it. And they try and give you gabapentin and other nerve blockers, nerve things, just to calm the pain because they don't know what the problem is. In this theory, it's all inhibition. The muscles, loss of power, losing joint stability. You then have nerves that have not sending clear signals, miscommunication. You get the sensation of burning, tingling, numbness. Even though all their x-rays, all their scans, they don't find any pinched nerve. They don't find anything that's causing the numbness, burning, tingling, all those things, okay? So that's kind of the idea.
Would neuropathy fall under that?
Yes, to a certain degree. But if we talk about neuropathy, you need to consider as well what caused the neuropathy. Okay? If they're like, we have no idea because there's no diabetes, there's no gout, there's no greater problem, then I'd say, yeah, I've had some pretty good success with neuropathy. But if the problem is that you're eating tons of sugar and you have type 2 diabetes and it's causing neuropathy, well, we got to fix plan A and the problem, because I can reset the nerves all day long, but if you're just going to go in that greater trauma thing, it's going to keep tripping the breaker, and so we're going to get absolutely nowhere. All right, so you need to heal the bigger thing, then we can take care of the inhibition. Okay? Great question, though. Great question. But the idea is very similar. Most commonly I do with CRPS because that's one of those things that people are like, I have no idea why this happens. I'm going to talk a little bit more about the other.
With CPR, I have 2 people very close to me with that.
I treated, in the last month, I've done 3 cases.
And they've got better.
All 3. Yeah. There's only one case in my 5 years of practice that I haven't been able to fix. I don't know why. That was a strange case.
4 cases of what? I didn't hear that.
CRPS, chronic regional pain syndrome. Yeah. So that one, I still don't know. Anyhow.
And it's killing you.
I will tell you, it is killing me. There are very few people who have come into my office that I haven't been able to, I'll tell you up front, right, I can't help you. Sorry, there's a greater thing going on here. But those who I'm like, no, we can get it. We just need to be a little bit more specific about what's really going on. And when I can't get it, I'll tell you, it is incredibly frustrating. Now, we can talk about nerves, we can talk about muscles. The same thing happens with organs, okay? Organs, you get punched in the gut, you get in a car accident, you have something that shuts an organ down or inhibits the organ. You then have poor digestion, bad absorption. You can call it all sorts of stomach problems. You can call it, I have allergies. I have whatever it is that causes your bloating and your this and your that. Typically, organs. All right? As a chiropractor, I have to add right now, it's not in my scope of practice to be an endocrinologist. It's not my scope of practice to be a neurologist. So anytime anyone comes into my office and says, hey, I want you to work on my nerve stuff, my organ stuff, I have to say, all right, you are here of your own free will and choice, and you understand that any care that I recommend is not in my scope of practice, so you're coming back because you want to, not because I recommend that you come back. Because it's not my scope of practice. Other than that, I have found, let's see, to date, there were 1 person who had hypothyroid who has been corrected. I've had 2 people who have had adrenal fatigue, I can't remember, I don't think it was adrenal fatigue, it was adrenal something. What was it called? It's the fancy name for adrenal fatigue. They have a diagnosis for it, when it gets so low that it causes problems in their body. But that person was like 3 years ago, and I haven't seen him since. I hope it's because everything is still going well. Anyhow, but as a whole, these organs, they don't function fully. You can get all sorts of then cascading events throughout the body. If your organ doesn't work, you don't get nutrients into your body. If you don't get nutrients into your body, you then can have some significant deficiencies in whatever nutrient that you're lacking, all the things that happen. Yeah, we're going to get more into that a little bit more later. But the idea is that if these things don't function fully, something else has to help, creating adaptation and compensation. So if you've ever heard someone say, well, ever since I rolled my ankle a bunch of times, or typically it's not ever since, but someone says, I just have chronically tight hamstring. I just have a chronically tight calf. Fill in the blank, right? That chronically tight traps. It's typically because Adaptation, compensation. You've likely had a whiplash injury for the sake of the traps. You've likely had a whiplash injury, shut down a bunch of neck muscles. The traps are trying to do the job of the shoulder and the neck and the this and the back and the, you get the idea? That same thing happens then with organs, nerves, all right? If one thing doesn't work, adaptation will ensue, and you get some weird symptoms because you get parts of your body that are working really, really hard to do the job of an inhibited muscle or of an inhibited nerve. That one thing is the problem, and we just had to find it out. All right? The result, typically during adaptation, you get ongoing pain, more injuries in more places. Ever since that ankle sprain I had, my knee has just been super weird and it's been tight. It's because the knee muscles are trying to do the job of the ankle muscles. And the same thing happens up the spine, all right? The most common one I see is back pain and hip pain. Well, I've got hip pain. Well, let's fix the back then. Well, why the back? Well, because typically if your pain is in the hip, it's because the back muscles aren't doing their job. Hips compensating. Hips tightening up theirs to try and stabilize the spine because the spine is ineffectively doing so. Okay? All right, how am I doing on time? About halfway through. A little bit past halfway. All right. So I mentioned this a little bit already, but why adjustments aren't enough? Well, if the inhibited muscles aren't doing their job, you're going to be back over and over and over again because the muscles aren't keeping the bone where I put it. All right? Massage, focus on the tight muscles. I mentioned about the tight muscles, yeah? They're focusing on the tight muscles. The tight muscles are typically, in my experience, doing their job very well for the other problems. So then you get the massage, it relaxes the tight muscle, but then 3 days later it's back because something has to stabilize. If there indeed is inhibition across the joint, those functional muscles, they still have to do their job again. So they tighten right back up to give you that tight muscle. All right? Physical therapy. It's great. They focus on the weak muscle though. If the muscle is neurologically shut down or inhibited, then strengthening it isn't going to be the problem or isn't going to be the solution because it can't strengthen to begin with. Does that make sense? So that's where a lot of people with physical therapy will say, well, I plateaued. It was great. Everything was going great for months, and then it just stopped improving. The reason, in my opinion, and this theory with inhibition, is that if you have 32 muscles in the knee, and in whatever knee injury you sustained that required surgery or then rehab, if you only have 10 working, you then go to physical therapy, you're going to strengthen the 10 muscles, which increases the likelihood of adaptation and compensation. All right? But those 10 are a lot stronger in creating that adaptation. So the pain gets better as you're working it out. But it plateaus because you only have 10 muscles working across the joint. And so it caps, it limited to how good it can be. Then if we get in where we re-engage some muscles, then you keep doing your physical therapy, pain goes away real quick typically. All right, medical and pharmaceutical, they focus on the pain as a symptom. My experience with that is the cortisone shot, the steroid shot, the shot that takes away the pain but doesn't, in my opinion, doesn't really fix the problem. There's typically something underlying there that is the greater issue. Then you're going to go back and get your next shot every 3 to 6 months. Inhibition is not weakness, all right? There's that difference. One is shut off, one is not. As part of the initial exam process that I go, if you came in with a bad ankle, I would test the strength of the ankle muscles. Lift your toe up, point your toe down, move your toe out, move your toe in, and I'm going to pull on your muscles and see which ones are working and which ones are not, all right? So aim it is the idea that these muscles need to be tested one at a time to find out which ones are inhibited. The weak muscles will gain strength. The inhibited muscles can't. I mentioned that already. So the purpose of AIM-IT is to reset muscles to improve joint stability. All right? The advantage, though, is that they also help predict where your future injury is going to be. If you don't have pain in the knee, but you twisted your knee or you damaged your knee when you were 25 years old, I can still today test that injury and there's still a problem there. Okay? So I can say, hey, of the knee muscles, you have 15 that are shot. All right? So if you damage your knee again, you're likely going to have some significant issues that time. Maybe this first time you didn't shut down enough muscles to create a big long-term problem, but I can, by testing all the muscles of the knee, tell you, well, of the knee muscles, you have 50% of them that are working. By the time you get to about 20 to 30%, that's when the pain ensues. All right? So by testing these muscles, we can find a problem before the pain comes on. But this typically is where people will come in for treatment, and they'll say, you know what, I am a triathlete, and I need my body at peak condition. All right, and as a triathlete, they'll come in on a regular basis and just say, you start at the ankles and you test every muscle. On the first visit, I do not test every muscle. There are 400 on one side of the body. I'm not going to spend that much time, so I typically focus on the area that you came in with. But that's kind of the idea there. How am I doing on time? I got 5 minutes. I got to cook. All right. So the neural pathway integration is the other certification that I have. Okay. Neural pathway integration is just the idea. The AIMIT is muscle integration. It is simply the idea that muscles are shut down. They get better with resetting. Okay. The AIMIT technique is how that resetting process happens. I can explain that to you if you ever come to my clinic. But neural pathway integration, a guy about 6 years ago in 2019, he's well trained in AIMIT. He's been doing AIMIT for 20 plus years. He started thinking, well, if a muscle can shut down, is it possible that a nerve can shut down as well? All right. That's when it grew into something bigger with neural pathway integration. He started finding treatments to help dizziness, vertigo, migraines. He's had 3 cases in his clinic. I haven't had a case in my clinic yet. He's had 3 cases of Bell's palsy. He's had so many cases of tremor that people, when they can't eat their food, no one knows what the heck the problem is. In my opinion, in this theory, it's all problems with the basal ganglia. You poke on very specific pressure points, reset the basal ganglia, you can get that knife or that fork right to your mouth quite simply. And it's super cool. It's so weird to the point that if you ever visit Miss Jane, who's in my booth right now, she'll tell you it's miracle work, and it really is cool. Because even if I had a guy just 2 weeks ago who came in after doing a full sever of his patellar tendon. All right, he had surgically repaired because if it's broken, you need it fixed. 6 weeks after his surgery, he comes in, he starts getting muscle work done on his quad, and he has a completely flaccid quad. There is no strength. There is no action. He can flex his left one just fine. There is no action in his right quad after that tear. We hit the right nerve, because that's more of a nerve thing. We hit the right nerve, and he had full contraction after the 3rd visit. It took me a little bit with that one to find the right nerve, because there are a lot of nerves, I will tell you what. All right, but this corrects the problems that keep the body from healing. They're great for chronic pain, nerve issues. I mentioned a couple of those. How are we doing on time? Woo, 3 minutes. All right. So I kind of mentioned a bunch of these already. AIMIT and NPI, the idea is that it helps you heal your body faster, okay? You're going to stay in alignment longer if you're worried about your misalignment because you went to a chiropractor that said you need to be perfectly aligned, otherwise you're going to die. I disagree with those chiropractors. I'm a little bit more structurally sound. Not that I disagree with the chiropractic philosophy, but that's just how I do it. I mentioned about this, don't worry, if it's structurally damaged, I can't help. Get the healing done first, then we can get into the inhibition stuff, okay? I had mentioned a couple of stories there. I have a lot of stories. If you follow me on Instagram or Facebook, there are testimonials that I share, and it's super cool, the people that come in. And even cases that are like, hey, can you fix this? If I've never treated you before, I'll be front and I'll say, I've never done that before, but I'd love a shot. So, and then adding on to that, I will always say that I want 4 visits to see if I can change it. All right? If I can't change it in 4, I'm not wasting your time. All right? There's something else, a greater injury, if you will, that needs to be fixed first, and I don't want to waste your time in my office if we need to focus on that. Okay? As a whole, just this idea, it's not about moving bones, it's about making sure your whole body works as a whole. And then AIMIT and NPI unlock your body's power to heal itself. Your body's pretty darn cool, and it can heal pretty darn well. We try to encourage that healing, okay? If you're interested and not sure we can help, ask. I'd be happy to talk to you about it, all right? Any phone calls, things like that, they're all free. If you get into my office and schedule time with me, I do an exam, and I will charge for the exam because I'll dig a lot a bit deeper into your injuries, okay? Any questions? Pretty weird? We'll start here at the front.
So, the body inhibition, if your body doesn't heal correctly after an injury and the muscle isn't doing what it's supposed to do, it's not the muscle's fault, it's really the neural
connection. Yeah, it's that safety mechanism.
Okay, so the nerves are preventing the muscle from healing correctly.
Yeah, because the nerve's going to say, well, you just overdid it. I'm not going to let you do that again.
So it stops connecting to the muscle, so to speak.
So to speak. Yeah, so to speak. I have a different presentation on the nitty-gritty of it, but you had a question as well.
That's okay. Well, it's insurance related, but I can connect with you later on that because you have a booth here, right?
Yes, ma'am.
And I go to High Therapy. I work with, or not work with, Devin's my personal
Ah,
therapist.
yeah,
So
yeah.
that's my work.
He knows this theory well because he does very good. The physical therapist at Hive Therapy, who I work with, he says, well, we're doing a workout and you just can't contract that muscle. And he can notice it and say, you know, you might as well go and get it re-engaged, reactivated.
Oh, okay.
And then we can keep going on it, which is what I try to educate every physical therapist. Most physical therapists and most practitioners as a whole don't like me because I try to tell them that, hey, you've got part of the problem. He's got part of the equation. You've got part of the equation. He's got part of the equation. No one likes to be told they're wrong. Not that I'm trying to tell them they're wrong, but I'm like, you got part of it. Let me help you along the way. But
Okay, good to know. I appreciate that.
yeah.
I go to Gavin, and he is excellent. He has the best bedside manner.
Well, I appreciate it. Any other questions? Perfect. Well, thank you very much for your time and hearing me babble. I hope it was educational to a small degree.